Cholera is a waterborne bacterial disease that is highly virulent. It is easily transmitted from one person to the other if control measures are not put in place. My name is Lilian Momina. I am a clinical nutritionist, and in today's video, we're going to talk about how to prevent or control the cholera since we have the outbreak in Nairobi, the capital city. Why is cholera a concern of public health? Number one, because it is infectious. The second thing is because of the means of transfer of the bacteria, that is water. And you see in Nairobi County we have a lot of issues with our sewage and drainage systems. The county government needs to work on that. It can be very fatal if not controlled. Common sign and symptom is basically diarrhea. You're passing a lot of watery stools, and this comes along with a lot of fluid losses, electrolytes, nutrients, and all this can cause severe shock, malnutrition, and eventually death if not controlled. If you have excess diarrhea, you'll get fever, your body will start reacting. You can experience vomiting because it's an intestinal problem. You can also have some nausea here and there and headaches because of dehydration and such. When you suspect you have cholera, the first thing that you need to do is get the ORS, the oral rehydration solution. This is basically a mixture of salts and sugar. You mix it with water, like 1 sachet of ORS mixes with 1 liter of water. That is basically the WHO standards, and it is acceptable. You can take up more of this fluid or less depending on how frequent your episodes of diarrhea or vomiting are. If you're having frequent episodes of diarrhea or vomiting, you're definitely losing a lot more fluids and a lot of more electrolytes, so you need to replace more than someone who is not. Of course, for someone who the dehydration has advanced to stages like maybe it can be classified as severe, you might need intravenous fluids administered by a professional. The second thing that you need to do if you suspect that you have the exposure is visit your nearest public health facility and report the case. You're going to reduce the chances of transferring the bacteria to your loved one or to your neighbor. Another thing, when you're going to report, you're not going to be isolated in bad situations. No, it's only for a few days because the administration of antibiotics has been shown to reduce the quantities and the transmissibility or the virulence of these bacteria. The county government or the Ministry of Health officials can actually start inspections around your area to identify any other cases. It will also help your neighborhood in ensuring that there is safety water and sanitation practices. So we are currently having the outbreaks in the regions of Umoja. I understand that region very, very well. So I understand how bad the sewage system is, how terrible the drainage system is, and it's the rainy season that makes it even worse because of the transferability of these infectious agents. So those 3 people in the regions of Kayole, regions of Umoja, Donholm, Komarok, Manyanja Road, Kangundo Road, or anywhere near Mama Lucy, there are isolation and treatment centers at Mama Lucy Kibaki Hospital. So if you suspect that you have a case, please go there. Another thing, also look out for these signs in children because they are most vulnerable because of their high nutrition needs and such, because your nutrition status determines your health and your immune function. People who are vulnerable, I'll briefly mention them. We have children, that is infants and children under the age of 5 years. We have pregnant and lactating moms because they have high nutrient needs. People living with HIV and AIDS. We also have people living with chronic conditions like diabetes, cancer, arthritis, hypertension, and all this. They have a compromised immune function, so their body's ability to fight infection is a bit compromised kidogo. We also have the elderly. If there's cases of cholera in somewhere where there's a population of elderly, it is definitely a concern. But again, those regions that I've mentioned, the Embakasi East, Central, and such, we don't have a lot of population who are elderly. So those are some of the signs and symptoms and things that you can do if you suspect that you have gotten the cholera exposure. So how can cholera be controlled? Cholera is basically a water, sanitation, and hygiene condition. Shida ya uchafu, in short. One of the things that you need to do is try as much as you can to have access to clean water. I understand that a lot of us in Nairobi do not have access to like piped water or constant flowing water. If you can, try and boil the water that you're going to use for cooking, for drinking, and this is not the time to drink piped water. If you can, also get the treated water. It is very necessary. The basic water and sanitation hygiene protocols, that is basically cleaning your hands immediately after using the toilet, cleaning your hands immediately after changing the baby's diaper, cleaning your hands before you're cooking, washing your vegetables well and ensuring that they are well cooked, peel fruits, those that can be peeled. Also make sure that the baby's hands are well cleaned, ensuring that your kitchen surfaces are well cleaned, your toilet areas, and again proper disposal of the fecal matter, because the bacteria is transferred through the feces. If you don't have a flushable toilet, you can use latrines. Nairobi City Council, we don't have access to a lot of latrines, and we have a lot of toilets with very bad conditions. When you use such toilets, make sure that you clean yourself well. Wash your hands properly with soap and water. So how long can someone stay after getting exposure to the bacteria before showing symptoms? Again, depending on your nutrition status and your health status. And some other people do not even show symptoms. The infection resolves itself because your body is in a position to fight off this bacteria. But you see, they might not be showing symptoms, but it can still transfer to someone else if they practice bad water and sanitation practices. Thank you so much for watching. Kindly consider subscribing and give this video a like, and until next time, bye.